we believe we are the first centre in Canada to be able to perform same-day knee replacements using minimal to no narcotics. Generally speaking, the technique is similar to that of the traditional knee replacements, with small techniques that are changed throughout the procedure to minimize pain. In addition to that, it is non-narcotic based protocol beforehand, anesthesia-driven pain blocks, and rapid mobilization after surgery. And when you combine it all together, allows patients to be more comfortable, to walk sooner, and to be discharged to the hospital on the same day.
The day of the surgery, I came in and the surgery was done between 8:30 and 10:30 in the morning. I was up on a walker about an hour and a half after getting out of the OR. I was home by 5. The next day I started my physiotherapy with a lot of ice, virtually no pain medication. Back at work after 10 weeks. Work involves long shifts and a lot of walking. I probably do 12 to 15,000 steps a day in a warehouse on concrete, and the knee held up fine. I can't thank Dr. Sharma and his team and everybody enough for basically giving me my life back is what it amounts to.
Together, we do amazing things every day.